Have you seen this banner before? So has Jay, a 25-year-old who lives in a dengue red zone. He's aware of the risks and actions to prevent dengue, but he fails to see dengue as a personal threat because he has never had dengue before. At the HDB lift, he notices a digital banner showing real-time information retrieved from an open data source. Information like the weather is shown before highlighting how these factors can affect personal dengue risk. He's alerted that there is a personal risk assessment available at any community centres or polyclinics. This assessment utilises real-time data from the National Environment Agency to provide an accurate evaluation. The assessment utilises a matrix that combines likelihood and harmfulness. Jay enters his postal code and location-specific dengue data is retrieved. This includes number of new dengue cases, the density of the area's population, number of identified mosquito breeding sites, and the rainfall history. The system will then use this data to calculate a score for his likelihood of getting dengue. He will then answer 4 key questions identifying his risk factors, such as age, whether he has had dengue before, whether his household members has had dengue before, and whether he has diabetes, affects his risk of getting severe dengue fever. The assessment will then calculate the harmfulness of dengue to him. Using both the evaluated scores of likelihood and harmfulness, a personal dengue risk score will be calculated. He will also be reminded of the actions he should take at home to prevent dengue. With a mosquito repellent patch and a personal dengue risk card issued, Jay is able to scan his QR code to access his daily updated personal risk assessment as an online digital calendar. His dengue risk score for that day and a breakdown of the risk will be shown. He is also able to retrieve his dengue risk history and identify fluctuations in his risk, possibly notifying him of an increase in dengue risk in the future. The same risk assessment is also accessible through the QR code provided on the HDB screen. A digital copy of the card will be sent to the user via email. After learning of his risk to dengue, Jay can put on the complimentary mosquito patch to keep himself safe. The prominent smell and colour of the patch nudges Jay's friends to ask about it, prompting Jay to spread awareness about the assessment and the fluctuating risks of dengue. So what can this collected data be used for?
A patient's trend data can help doctors recommend dengue blood tests to high-risk patients for early diagnosis.
NEA can also utilize the data to identify neighbourhoods with a higher proportion of high-risk individuals for better allocation of resources.
So I think in terms of the applications that you all are trying to develop here, in the sense of communicating the actual risk to the public, using a more dynamic strategy instead of just maybe a static banner. However, there's still a lot more to be tested as well to understand the real potential public health impacts to the population at risk in terms of how this digital information technology can help to change some of their behaviors by not just increasing their knowledge but also sharing with their friends, in terms of the actual knowledge that's required to minimize their risk for dengue.